Jiggers are small insects, also known as sand fleas, chigo fleas, or scientifically, Tunga penetrans. They are the smallest type of flea in the world, measuring less than 1 millimeter in size. Even though they are so tiny, they can cause painful infections in humans and animals. Unlike normal fleas that just bite and jump away, jiggers do something far worse. The female flea digs into the skin of a person, usually in the feet or toes. Once inside, it feeds on blood and lays eggs. This causes swelling, pain, and wounds that can become infected. In many African countries and some parts of Latin America, jiggers are a serious public health problem, especially in poor communities where people walk barefoot and live in dusty environments. Jiggers prefer dry, sandy, and dusty environments. Villages with dirt floors, poor housing conditions, and lack of proper footwear create the perfect environment for them. They thrive in dusty soil around houses, cracks in floors and walls, areas where animals like pigs, dogs, or goats sleep. Because they are so small, people often don't notice them until the pain starts. Children, the elderly, and people living in poverty are the most affected because they walk barefoot and don't have proper medical access. The life cycle of the jigger flea is unique. Here's what happens. The female flea jumps onto a person's skin, usually the feet. She burrows into the skin, often under the toenails or between toes. Only the back part of her body stays outside, allowing her to breathe and release eggs. Inside the skin, she swells up as she feeds on blood. After about 2 weeks, she lays eggs, which drop into the environment and hatch into new fleas. This cycle means that one infected person can unknowingly spread thousands of new jiggers into their surroundings. The symptoms can be very painful and disturbing. Redness and swelling where the flea has burrowed. Intense itching and discomfort. Pain when walking or standing. Visible black dot at the center of the swelling, which is the flea's body. Multiple sores. If many fleas have entered the skin, in severe cases, toenails may become deformed or fall off. If untreated, jigger infestation can lead to secondary infections like pus and abscesses, tetanus risk due to open wounds, difficulty in walking, going to school, or working. Beyond the physical pain, jiggers also bring stigma and shame. In many rural communities, people with jigger infestations are sometimes seen as dirty or careless. Children may stop attending school because of pain or embarrassment. families may face discrimination. In truth, jiggers are not a sign of laziness or dirtiness. They are a disease of poverty. People are affected because they lack shoes, proper flooring, and access to health care. Treating jiggers involves removing the flea from the skin. This can be done in several ways: careful extraction using sterile needles or safety pins, washing and disinfecting the wound with antiseptics, applying antibiotics to prevent infection. In some cases, soaking feet in medicated solutions to reduce pain and kill remaining eggs. In severe infestations, medical professionals may be needed to treat multiple sores and infections. Prevention is always better than cure. Communities can protect themselves through simple measures. Wearing shoes protects feet from fleas entering the skin. Improved housing, cementing floors and filling cracks reduces breeding grounds. Regular cleaning, sweeping and keeping houses free of dust helps control fleas. Animal care, treating pets and livestock to prevent them from carrying fleas. Community programs, educating people about hygiene, organizing mass treatments, and supporting poor families with shoes and medical supplies. Jiggers continue to be a problem, mainly because of poverty, poor healthcare access, and lack of awareness. While they can be controlled with simple methods, many affected communities cannot afford these solutions. Children walking barefoot, families living on dusty floors, and lack of medical care create a cycle that allows jiggers to spread generation after generation. Organizations and charities in Africa and Latin America have been working hard to fight jiggers by providing shoes, medical kits, and education programs. But lasting change requires governments and communities to invest in better living conditions. Many myths surround jiggers. Let's clear up some common ones. Myth 1. Only dirty people get jiggers. Truth. Anyone can get jiggers if they walk barefoot in infested areas. Myth 2. Jiggers only affect humans. Truth. They also affect dogs, cats, pigs, and other animals. Myth 3. Jiggers are the same as lice. Truth. Jiggers are fleas, not lice. Lice live in hair, while jiggers burrow into skin. Jigger infestation is not just a health issue, It is a human rights issue. Every child has the right to education, yet many drop out because of the pain. Every person has the right to health, yet many cannot afford treatment. Addressing jiggers means addressing poverty, inequality, and neglect. So what are jiggers? They are tiny fleas with a big impact, small enough to hide in the dust, but powerful enough to destroy lives when left untreated. They cause pain, shame, and disability, but with simple solutions, like wearing shoes, improving homes, and raising awareness, this problem can be controlled. By understanding jiggers, we can help spread knowledge, break the cycle of poverty-related diseases, and support communities to live healthier, dignified lives. Education is the first step toward change.